Aging is a journey filled with moments of wisdom, love, and cherished memories. But as life reaches its final chapters, the body begins to send signals that often go unnoticed. Many assume that death comes suddenly in old age, but in reality, the body gradually prepares itself for the transition. Recognizing these early signs allows families to provide comfort, dignity, and meaningful support to their loved ones in their final phase of life. In this discussion, I will draw upon decades of medical practice to explain these signs in depth, share personal insights from my experience with elderly patients, and provide compassionate guidance on how to navigate this delicate stage of life. Let's explore the 5 key signs that indicate a person may be in their final year and how you can support them with love, understanding, and grace. Number 1, significant weight loss, a deeper look at the body's preparation. Weight loss in elderly individuals is often dismissed as a natural part of aging, but when it happens rapidly and unintentionally, it can be a sign of the body's declining ability to absorb nutrients. The aging process naturally brings about changes in metabolism, muscle mass, and overall energy levels. However, when weight loss occurs unexpectedly, it may indicate underlying health concerns that require attention. As people age, muscle mass diminishes due to sarcopenia, a condition where the body progressively loses muscle strength and function. This loss not only affects mobility, but also impacts metabolism. A slower metabolism means that the body becomes less efficient at processing food, leading to reduced appetite and nutrient deficiencies. Additionally, the digestive system undergoes changes, such as decreased production of stomach acid and digestive enzymes, which can hinder the absorption of essential nutrients like protein, vitamins, and minerals. Chronic illnesses also play a major role in unexplained weight loss. Diseases such as cancer, heart failure, kidney disease, and chronic obstructive pulmonary disease, COPD, often contribute to a gradual but persistent decline in weight. Many of these conditions can remain asymptomatic in their early stages, making weight loss one of the first warning signs. For instance, cancer-related cachexia is a condition where the body experiences extreme weight loss despite adequate food intake. This syndrome is commonly seen in patients with advanced cancer and is often accompanied by muscle wasting and fatigue. Beyond physical ailments, mental health significantly impacts eating habits and nutrition in older adults. Depression, anxiety, and cognitive decline, including Alzheimer's disease and other forms of dementia, can cause individuals to lose interest in food. In some cases, seniors may forget to eat altogether or struggle with meal preparation, leading to unintentional malnutrition. Social isolation further exacerbates this issue, as eating alone often reduces motivation to maintain a balanced diet. I once had a patient named Mr. Thompson, an 84-year-old gentleman who was always full of life. He had a sharp mind and loved telling stories about his youth. His family adored him, but over time, they noticed something concerning. He began losing weight steadily over 6 months. At first, they assumed it was just old age, a common misconception among families caring for elderly loved ones. His appetite declined, and he often complained about food tasting bland. His clothes became loose and he seemed to lack his usual energy. His family encouraged him to eat more, but his weight loss continued. By the time they sought medical help, his body had already begun shutting down. It was only then that they discovered he had an advanced form of gastrointestinal cancer, which had gone unnoticed due to the subtle nature of his symptoms. Had they recognized the early warning signs of significant weight loss and sought medical advice sooner, they might have been able to provide him with better support, whether through nutritional interventions, medical treatments, or simply ensuring his final days were spent in comfort and dignity. This story underscores the importance of not ignoring sudden changes in weight, as they can be an early indicator of serious underlying health issues. Recognizing and addressing significant weight loss in elderly individuals requires a proactive approach. Here are some strategies to help mitigate the effects and ensure proper care. 1. Encourage small, nutrient-dense meals. Large meals can feel overwhelming for seniors, especially those with reduced appetites. Instead, encourage smaller, more frequent meals that are rich in nutrients. Foods high in protein, healthy fats, and essential vitamins can help maintain muscle mass and overall health. Smoothies, soups, and fortified foods can also be useful in increasing calorie intake without requiring large portions. Number 2, prioritize easy-to-eat foods. Many elderly individuals struggle with chewing and swallowing, particularly those with dental issues or conditions like dysphagia. Soft, moist foods such as mashed vegetables, yogurt, scrambled eggs, and pureed meats can make eating easier. Avoiding dry or tough foods can help prevent choking hazards and improve mealtime experiences. 3. Ensure proper hydration. Dehydration is a common concern among older adults, particularly those who may not recognize thirst as easily. Ensuring adequate fluid intake is crucial, as dehydration can lead to confusion, weakness, and further appetite loss. Encourage sipping on water, herbal teas, or broths throughout the day, and consider hydrating foods like watermelon, cucumbers, and soups. 4. Address underlying health conditions. Regular medical checkups can help detect chronic illnesses early. If a senior experiences unexplained weight loss, a thorough medical evaluation is necessary to rule out serious conditions such as cancer, thyroid disorders, or gastrointestinal diseases. Treating the underlying cause can often help stabilize weight and improve overall well-being. Number 5, create a comfortable eating environment. Many seniors eat less when they are alone. Encouraging family meals, social dining experiences, or even playing soft music during mealtime can make eating more enjoyable. When possible, engaging in light physical activity before meals can also stimulate appetite and digestion. 6. Focus on comfort rather than forcing meals. For individuals in the later stages of life, particularly those with terminal illnesses, the focus should shift from trying to maintain weight to ensuring comfort. Forcing meals can create distress and discomfort. Instead, providing favorite foods, respecting their preferences, and ensuring emotional support can make a significant difference in their quality of life. Significant weight loss in elderly individuals should never be ignored. While aging naturally brings changes in appetite and metabolism, rapid and unintentional weight loss often signals a deeper issue. Recognizing these warning signs early allows families and caregivers to take appropriate action, whether by seeking medical intervention, adjusting dietary habits, or focusing on end-of-life comfort care. Ultimately, the goal is not just to prolong life, but to enhance its quality, whether through nutritional support, medical treatment, or simply being present with a loved one. Addressing significant weight loss with care and compassion can make a profound difference in the final chapters of a person's life. By staying attentive and proactive, we can ensure that our elderly loved ones receive the dignity, support, and nourishment they deserve. Number 2, extreme fatigue and weakness. The body conserving energy. Persistent exhaustion in older adults is not just about feeling tired. It reflects the body's reduced ability to circulate oxygen, metabolize energy, and maintain muscle function. Many seniors find that even simple tasks like dressing, walking, or speaking feel overwhelmingly difficult. While fatigue is often dismissed as a normal part of aging, in the final stages of life, it can be a sign that the body is entering a phase of energy conservation, focusing only on vital functions. As the heart and lungs weaken, circulation slows, leading to less oxygen reaching the muscles and brain. This decrease in oxygen supply can result in profound weakness, making even basic movements exhausting. Additionally, metabolic processes slow down, causing the body to struggle with generating energy efficiently. This explains why many elderly individuals sleep more, eat less, and interact less in their final months. Their body is not failing them. It is adapting to conserve energy for essential functions. Another key factor contributing to extreme fatigue is muscle loss, known as sarcopenia. As people age, muscle mass naturally declines, but in the later stages of life, this process accelerates, making everyday activities significantly more challenging. Coupled with changes in appetite and digestion, seniors often experience a decline in energy levels that is difficult to counteract. Beyond physical changes, certain medical conditions can exacerbate fatigue. Heart disease, chronic obstructive pulmonary disease, COPD, kidney failure, and advanced cancer are common culprits. Medications too can play a role. Some drugs used to manage pain, anxiety, or blood pressure can contribute to drowsiness and lethargy. Understanding these underlying causes can help caregivers and family members approach this phase with greater empathy. I recall a woman named Mrs. Jenkins, whose once lively personality faded as she grew more fatigued. She had always been energetic, enjoying long walks and deep conversations with her family. However, as the years passed, she began to withdraw. Her family initially pushed her to stay active, urging her to move around more and engage in activities. They believed she was giving up on life. What they did not realize was that her body was simply prioritizing survival. Her heart was working harder to pump blood, her lungs were struggling to deliver oxygen, and her muscles no longer had the strength to support her usual routine. The more they pressured her, the more she felt overwhelmed. It was only when they shifted their approach from one of encouragement to one of acceptance that her final months became more peaceful. Instead of pushing her to do things she no longer had the energy for, they began sitting with her, talking quietly and simply being present. They adjusted their expectations, understanding that her fatigue was not a choice but a natural part of her body's transition. By accepting and adapting, they made her remaining time more comfortable and meaningful. Extreme fatigue in older adults can be distressing to witness, but it is crucial to approach it with compassion and understanding. Here are some practical steps to support a loved one experiencing severe weakness. 1. Allow for more rest without guilt. Instead of encouraging them to fight through exhaustion, create a comfortable space where they can rest as needed. Frequent naps and periods of inactivity should not be viewed as laziness, but as necessary for their well-being. 2. Reduce physical demands. Encourage them to conserve their energy for meaningful activities. If walking to the dining table is too tiring, allow meals in bed or on a comfortable chair. If dressing independently is exhausting, offer assistance without making them feel like a burden. 3. Modify their environment. Ensure they have a supportive seating arrangement, easy access to necessities, and minimal obstacles. Small changes, like placing a favourite chair near a window or keeping essentials within arm's reach, can significantly reduce unnecessary exertion. 4. Prioritise comfort over productivity. Rather than focusing on what they can or cannot do, shift the focus to their comfort and emotional well-being. Listen to their needs, adjust daily routines to match their energy levels, and offer reassurance that it's okay to slow down. 5. Encourage meaningful interactions. When physical activity becomes difficult, social interaction can still provide immense emotional support. Holding their hand, sharing memories, or simply sitting in silence together can be more valuable than any physical task. Number 6, understand that appetite may decline as the body slows down, digestion also becomes less efficient and appetite may wane. Rather than insisting on full meals, offer small, nutrient-rich snacks and easy-to-digest foods that they find comforting. 7, provide emotional reassurance. Many elderly individuals feel guilty about their declining energy levels, believing they are a burden to their family. Offer reassurance that their presence alone is valuable and that their worth is not measured by what they can physically do. Fatigue and weakness in older adults, particularly near the end of life, are not conditions to be fixed. They are signals that the body is naturally slowing down, prioritizing essential functions over daily activities. By recognizing this, families can shift their focus from frustration to understanding, ensuring that their loved ones feel supported rather than pressured. Instead of resisting this phase, embrace it with patience and kindness. Accepting their changing energy levels allows for a more peaceful transition, fostering moments of connection and love. The goal is not to push them to be as active as before, but to create an environment where they can feel safe, respected, and cared for in their final stage of life. Number 3, cognitive decline and emotional withdrawal. Cognitive decline is a common occurrence in the later stages of life. It often manifests as increased forgetfulness, confusion, difficulty recognizing loved ones, or disinterest in social interactions. These changes can be subtle at first, but tend to become more pronounced over time. From a medical standpoint, the brain, like any other organ, requires proper circulation and oxygenation to function efficiently. However, as the body starts prioritizing essential functions in the final stages of life, cognitive abilities begin to diminish. This decline is not just a result of age-related changes, but often a sign that the body is slowly shutting down. The brain's neurotransmitters, which facilitate communication between neurons, may become less effective, leading to lapses in memory, attention, and even personality changes. In addition to forgetfulness, some elderly individuals experience a withdrawal from conversations and social interactions. They may speak less, avoid eye contact, or appear lost in their thoughts. This emotional withdrawal is sometimes mistaken for depression, sadness, or disinterest, but in many cases it is a natural part of the body's preparation for the end of life. Rather than an emotional disorder, it can be seen as a gradual disengagement from the physical world. Understanding these changes can help caregivers, family members, and medical professionals respond with compassion rather than fear. When we recognize cognitive decline and emotional withdrawal as part of the transition process, we can shift our focus from trying to reverse these symptoms to instead ensuring that the individual's remaining time is filled with comfort and love. One of my former patients, Mr. Anderson, was an 82-year-old man with a history of mild cognitive impairment. Over time, his family noticed that he was forgetting names, struggling with daily routines, and becoming increasingly quiet. His daughter initially believed he was developing early-stage dementia, and she became deeply worried. However, after medical evaluation, we found that while he did show signs of memory loss, his condition was not solely due to dementia. Instead, his cognitive decline was a part of the body's natural transition. Rather than trying to challenge his memory or push him to engage in conversations he no longer had the energy for, his family decided to shift their focus. They worked to create a peaceful and loving environment for him. His room was filled with familiar objects, soft lighting, and calming music. They sat with him, held his hand, and reassured him with kind words, even when he didn't respond. One of the most touching moments came when his granddaughter placed his favourite blanket over him and simply sat by his side. He didn't say anything, but he gently squeezed her hand. That small gesture spoke volumes. It reminded everyone that even though he was becoming less communicative, he was still present, still feeling, and still appreciating their love in his own way. If you have a loved one experiencing cognitive decline and emotional withdrawal, there are several ways you can support them with empathy and understanding. 1, speak calmly and offer reassurance. Use a soft, gentle voice when communicating. Even if they don't respond, hearing a familiar and soothing voice can provide comfort. Simple phrases like "I'm here with you" or "you are loved" can be reassuring, even if there is no verbal acknowledgement in return. 2, reduce overwhelming stimuli. A chaotic or noisy environment can be distressing. Try to create a serene atmosphere with soft lighting, comfortable surroundings, and minimal background noise. Playing their favourite music or familiar sounds from nature, like ocean waves or birds chirping, can have a calming effect. 3, maintain physical presence and connection. Even if they are not responding verbally, your presence is important. Holding their hand, lightly stroking their arm, or sitting close to them can bring comfort. Sometimes non-verbal communication, such as a reassuring touch or a smile, can mean more than words. 4, avoid correcting or challenging their memory. If they forget names or mix up details, gently go along with the conversation instead of correcting them. This can help prevent unnecessary frustration or distress. Instead of asking, "Do you remember who I am?" try saying, "It's me, your daughter Susan," with a warm smile. 5, recognize that they still feel your love. Even if they don't react outwardly, they still experience emotions. Love, kindness, and familiarity can reach them in ways that don't always require a verbal or physical response. Some individuals may seem distant, but small gestures like playing their favourite song or bringing a cherished photo can evoke subtle but meaningful responses. 6, encourage rest and comfort. As cognitive decline progresses, the individual may tire easily. Ensure that they have a comfortable resting space and allow them to sleep when needed. Soft blankets, warm socks, and gentle massages can bring physical and emotional relief. 7, support yourself as a caregiver. Watching a loved one withdraw can be emotionally challenging. It's essential to acknowledge your own feelings and seek support when needed. Joining a support group, speaking with a counsellor, or talking with other family members can help you process the experience with more resilience. Cognitive decline and emotional withdrawal are often misunderstood as signs of depression or apathy. In reality, they are part of the body's natural process of slowing down. By shifting our perspective from trying to fix memory loss to instead ensuring a peaceful and loving environment, we can provide comfort and dignity to our loved ones in their final stage of life. Even when words fade, emotions remain. Love, presence, and understanding can bridge the gap where language and memory fail. By approaching cognitive decline with patience and compassion, we can offer the most precious gift of all, unwavering support during life's final journey. Number 4, increased susceptibility to infections and slow healing. As we age, our immune system gradually weakens, making the body more vulnerable to infections and slowing down the healing process. This phenomenon is particularly evident in elderly individuals, especially those in the final stages of life. The immune system, which once efficiently fought off infections, becomes less responsive, allowing even minor illnesses to have severe consequences. A weakened immune system can manifest in several ways. Frequent infections such as pneumonia, urinary tract infections, UTIs, and skin infections become more common. Minor wounds like small cuts or bruises take longer to heal, increasing the risk of secondary infections. For elderly individuals, these infections can quickly escalate into life-threatening conditions, requiring hospitalization and intensive care. Medical professionals often observe that individuals in the later stages of life experience systemic inflammation, which further complicates the body's ability to heal. Chronic conditions such as diabetes, cardiovascular disease, and malnutrition exacerbate the problem, making the immune system even less effective. Additionally, the prolonged use of medications, including steroids and immunosuppressants, can further weaken immune responses. Patients undergoing chemotherapy or dealing with chronic illnesses often experience a heightened vulnerability to infections. This delicate balance between treatment and the body's natural defenses necessitates a shift in medical approaches, particularly when curative treatments become less effective. Watching a loved one suffer from frequent infections and slow healing wounds can be distressing for families. Many caregivers feel helpless as they witness repeated hospitalizations and the discomfort their loved one experiences. It can be difficult to accept that the body's natural healing abilities are declining, and this realization often leads to tough decisions about treatment priorities. Families may struggle with deciding whether to continue aggressive treatments or transition to palliative care. Infections that could have been treated with strong antibiotics in younger years may become recurring and difficult to manage. In such cases, caregivers must weigh the benefits and burdens of continued medical intervention against the patient's overall comfort and quality of life. One of the most challenging aspects is understanding when to shift from active treatment to supportive care. In some cases, aggressive treatments, such as intravenous antibiotic surgical interventions, may not significantly improve the patient's well-being. Instead, prioritizing symptom relief, comfort, and emotional support may be more beneficial. One of my patients, Miss Rose, was a vibrant woman who had always taken great care of her health. However, as she reached her late 80s, her body began to show signs of decline. She developed recurring urinary tract infections, which would weaken her each time they occurred. What used to be a minor inconvenience in her younger years became a major health concern, requiring hospitalization on multiple occasions. Her family struggled to decide whether to continue with aggressive treatments or focus on comfort measures. After consulting with her doctors, they realized that prolonging her life through repeated hospital stays and strong medications was causing more distress than relief. They made the difficult but compassionate choice to transition to palliative care, ensuring she remained comfortable at home. With better pain management, hydration, and gentle nursing care, Miss Rose spent her final months in peace, surrounded by her loved ones, rather than in a sterile hospital room. What you can do to reduce infection risks and support healing. While aging and declining immunity are natural processes, there are several steps that caregivers and family members can take to reduce the risk of infections and support better healing outcomes. Prioritize skin care. The skin serves as the body's first line of defense against infections. Keeping the skin clean, moisturized, and free from open wounds can help prevent complications such as bed sores. Regular repositioning of bedridden individuals can also prevent pressure ulcers, which are prone to infection. Maintain proper hygiene. Simple hygiene practices, such as frequent hand washing and regular bathing, can significantly reduce the spread of infections. For those who are unable to bathe daily, gentle sponge baths and clean clothing can help maintain hygiene. Ensure proper hydration and nutrition. Dehydration and malnutrition weaken the immune system, making the body more susceptible to infections. Providing adequate fluids, nutrient-rich meals and vitamin supplements can help support overall health and immune function. Encourage gentle movement. For individuals who can still move, light physical activity can improve circulation, prevent bed sores, and enhance immune function. Even simple activities such as stretching or assisted walking can contribute to better health outcomes. Monitor for early signs of infection. Caregivers should stay vigilant for signs of infection such as fever, increased confusion, loss of appetite, or sudden weakness. Early detection allows for timely intervention, which can prevent minor infections from becoming severe. Recognize when to shift focus to comfort care. If infections become recurrent and treatments become more burdensome than beneficial, it may be time to focus on palliative care. Comfort measures such as pain management, maintaining a soothing environment, and providing emotional support can improve the patient's quality of life. For individuals in the final stages of life, hospice and palliative care teams can provide invaluable support. These professionals specialize in managing symptoms, providing emotional and spiritual care, and ensuring that patients experience dignity and comfort in their final days. Transitioning to palliative care does not mean giving up on a loved one. Rather, it means prioritizing their well-being and making the most of the time they have left. The increased susceptibility to infections and slow healing in elderly individuals is a natural part of aging. While it can be distressing to witness these changes in a loved one, understanding the underlying causes can help families make informed and compassionate decisions. By focusing on preventive measures, prioritizing comfort, and recognizing when to transition to supportive care, families can ensure that their loved ones experience dignity, peace, and the best possible quality of life in their final stages. Number 5, changes in breathing and circulation. One of the most profound signs of approaching the final stage of life is changes in breathing patterns. These changes can be distressing for family members and caregivers, but they are a natural part of the body's transition. As the body prepares for the end, the respiratory system begins to slow down and irregular breathing patterns become more common. One of the hallmark signs is Cheyne-Stokes respiration, which involves alternating periods of deep and shallow breathing, often with pauses in between. These pauses can last for several seconds, leading to concern, but they are a natural part of the dying process. The body no longer requires as much oxygen, and the brainstem's control over breathing weakens. In addition, a weakening circulatory system can lead to noticeable changes in body temperature and skin color. As the heart slows down and becomes less efficient at pumping blood, the extremities, such as hands, feet, and even the nose, may become cold to the touch. The skin might take on a bluish or purplish hue due to poor circulation, particularly in the fingers, toes, and around the lips. This is known as mottling, a common sign that circulation is declining. Another issue is the buildup of fluids in the lungs, which can cause congestion and a rattling sound when breathing. This phenomenon, often referred to as the death rattle, occurs because the person is no longer able to effectively clear secretions from the throat and lungs. While this sound can be unsettling for loved ones, it does not necessarily indicate discomfort. I recall a patient, Mr. Lewis, who was in his final days of hospice care. His family noticed that his breathing had become more laboured, with long pauses between breaths. Every time he would stop breathing for a few seconds, his loved ones would panic, thinking the moment had come. His wife, in particular, found it difficult to watch him struggle with what seemed like breathlessness. To ease their distress, the hospice nurse explained that this pattern was normal and not necessarily painful for Mr. Lewis. She demonstrated how raising his bed slightly could make breathing easier, and recommended using a humidifier to help with throat dryness. We also gently reassured his family that, while the changes in his breathing might look alarming, he was not in distress. His family followed these steps, ensuring that he was as comfortable as possible. Over time, they came to accept that his slowing breaths were part of his natural transition. Instead of feeling helpless, they focused on being present, holding his hand, and offering quiet words of comfort. Their presence made all the difference. As a caregiver or loved one, witnessing these changes can be difficult. However, there are ways to provide comfort and support. 1. Keep them comfortable in a relaxed position. Positioning plays a significant role in easing respiratory discomfort. If the person is experiencing congestion or shallow breathing, try elevating their head with pillows or adjusting the hospital bed to a slightly upright position. This can help with fluid drainage and make breathing less laborious. 2. Offer sips of water or ice chips. Dryness in the mouth and throat is common due to decreased fluid intake. Offering small sips of water, ice chips, or even swabbing the lips with a damp cloth can provide relief. However, if swallowing becomes difficult, consult with a healthcare provider to avoid choking risks. 3. Use a humidifier or fan. A humidifier can help prevent the airways from becoming too dry, making breathing easier. Some caregivers also find that a gentle fan positioned nearby can provide comfort, as the movement of air can reduce the sensation of breathlessness. 4. Provide reassurance and a calm presence. Even when a person is unconscious or minimally responsive, they may still hear and feel the presence of loved ones. Speak softly, hold their hand, and offer reassuring words. Letting them know that they are not alone can bring immense comfort. 5. Understand that these changes are a natural part of the transition. Perhaps the most important thing is to recognize that these changes in breathing and circulation are a natural part of the body's process of shutting down. While they can be difficult to witness, they are not necessarily a sign of suffering. Accepting this reality can help caregivers and family members feel more at peace with the process. Changes in breathing and circulation are among the most noticeable signs of approaching the end of life. Understanding what to expect can help ease anxiety and allow loved ones to focus on making the person's final moments as comfortable and peaceful as possible. By providing physical comfort, reassurance, and emotional support, we can help ensure that they transition with dignity and ease. Understanding these 5 signs can transform how we approach the final phase of life for our loved ones. Instead of fear and uncertainty, we can bring peace, comfort, and presence to those we cherish most. Recognizing these signs allows us to provide the care, love, and emotional support that make this transition as gentle and meaningful as possible. End-of-life moments are often accompanied by a mix of emotions: grief, love, reflection, and even gratitude. By cultivating awareness, we shift from resistance to acceptance, embracing the journey with deep compassion. When we understand what is happening, we can be more present, ensuring that our loved ones feel seen, heard, and valued in their final days. If you found this discussion helpful, please share your thoughts in the comments. Have you noticed any of these signs in a loved one? How have you navigated this journey? Your insights can provide comfort and guidance to others walking a similar path. Remember to like, subscribe, and turn on notifications for more content on health, wellness, and aging with dignity. Your support helps us continue our mission at Golden Years Balance to bring compassionate and insightful discussions on aging and wellness. Thank you for being here, and I look forward to seeing you in the next video.